There are classic psychedelics, things like mushrooms, ayahuasca, LSD, and then there are the medicines that we put in this category, such as MDMA, ketamine, that are not classic psychedelics. So MDMA is the most interesting. I like that comment from David Nutt. And I would agree with that. I would say MDMA is less dangerous than drinking alcohol. So, randomized trial published in 2021 showing that for people who've got severe post traumatic stress disorder, they did 2 to 3 treatments with MDMA assisted therapy, and two-thirds of them no longer met criteria for PTSD. This is huge. This is huge. Why is this huge? Because we know that if you get the standard of care for post traumatic stress disorder, which is talk therapy, sometimes trauma informed, together with selective serotonin reuptake inhibitors, that the benefit, the efficacy is somewhere around 30%. It's abysmal. If I had known that about the therapy that I did in my 20s, I don't know that I would have done it.
And maybe why people give up. It may be why people give up, right?
I mean, it's so expensive. It takes so much time. It takes, some people are in therapy for decades and they're not getting better. And what we know is that the part of the brain that is involved in understanding trauma is different than the part of the brain that's involved in resolving trauma. So you can't think your way into resolving the trauma.
So that's the part of the brain. So that's why it's working, because what part of the brain is it activating?
The brainstem is involved. And this is newer research. So the cerebellum and the brainstem are involved. There's some other parts of the brain that are a little more complex that are involved in trauma. But I think, understanding your trauma, knowing why your mother did what she did or your uncle did what he did, like that's not going to help you heal.
Mm.
So we
Mm-hmm.
need a different strategy. And we know that MDMA assisted therapy is more than twice as effective as the standard of care. And then we had a new randomized trial that was published, another phase 3, in a more diverse patient population. So more than 50% non white people who had moderate to severe PTSD. They got MDMA assisted therapy, and 71% of them resolved their symptoms. So this is incredibly effective. We expect that MDMA is going to get FDA approved in the United States sometime in the next year, and it's coming. So we need to know how to use it. It's very effective in terms of regulating the trauma signature in the body. And is that the case for people who have, I don't have post traumatic stress disorder, but I've got subthreshold partial PTSD. And so MDMA assisted therapy is really effective for me. So there's lots of different indications. As you described, there's studies looking at some of these medications like ketamine for eating disorders, using psilocybin mushrooms for depression and for end of life and for alcohol use disorder. So there's lots of different ways that these medications will be used. But what I get excited about is how regulating they are. And I can tell you
Wow.
with each journey I've done, and I'm happy to talk about my
Yeah,
experiences over the
please.
past 5 years. I mean, first, let me say I was such a square. It wasn't until I turned 50 that I started to see this data on trauma. And I was like, oh my gosh, if you can resolve trauma, we have to do that. We have to do that by whatever means necessary. So that's when I did my first MDMA assisted therapy with a psychologist. I think the therapy part is really critical. We're not talking about recreational use of these medicines. And I can tell you, my heart rate variability doubled in the 2 weeks afterwards. My blood sugar was better. My sleep was improved. There's this initial 1 to 2 day autonomic effect where your sympathetic nervous system is more activated. But then after that, I was in a state of regulation that I can demonstrate with my aura ring. And that's what we want. We want to have that kind of specificity to show that, okay, here I am dysregulated again. And these treatments, whether it's meditation or some other healing state of consciousness, like using sacred plants, this is the effect of it. This is how it regulates me. And not everyone needs those. I mean, there's so many different ways to regulate yourself. It doesn't mean that everybody needs to take psychedelic medicine, but it's increasingly going to be an option in the 5 to 10 years to come.
I think it's just so fascinating, and also just to hear about, your journey of doing it 5 times, because at the moment, especially in the UK, it's not regulated. So it's really hard to know, how can I seek this? How can I do this in a way that is therapeutic, is what you said? Because at the moment, people are really listening to MDMA and just thinking recreational drugs. But actually, it's a completely different experience when you're doing it with a psychotherapist in a therapeutic setting. But you touch upon all the different therapies in your book, which I found really fascinating. But you also touched upon something else that is really close to my heart, and I'd never spoke about on this podcast before, but it was a lot about the energetic body. Okay, and I feel like this will probably pull into some of the work as well that comes up through psychedelic treatment. But chakras, auras, meridians, all of these things, I felt I kind of got pulled into the direction when I was about 21, and then went into kind of the medical community and thought, right, I cannot believe in this anymore because nobody's going to believe me and everyone's going to think I'm a bit woo-woo. But so on the side, it's kind of been part of my life. And when I read your book, I resonated with it so much. And I loved that you spoke about this with just so much authenticity and power behind it, because I think it's such an untouched area. And this whole like spirituality that people say like this does now have scientific evidence behind it. And I think it's so important. So I just really want you to kind of talk to me a little bit about, the energetic body and how we can come more aligned with that, because I guess this is such a big part of the healing process.
It is a huge part of the healing process. Yeah, subtle energetic anatomy has been known for thousands of years. I first learned about it when I did a yoga teacher.
Thanks so much for listening. To hear the full episode, there's a link in the description.